Male loneliness in the United States is a growing crisis with profound sociological, psychological, neurological, and biological consequences. The decline of male social bonds has accelerated in recent decades, leading to increased isolation, depression, and suicide. In 1990, only 3% of men reported having no close friends, but by 2021, that number had risen to 15%. American Survey Center, 2021. The amount of time men spend with friends has decreased by 50% since 2003. American Time Use Survey, 2021. Marriage rates have also declined significantly, with 70% of men aged 25, 34 being married in 1980, compared to only 36% in 2023, U.S. Census Bureau, 2023. Pew Research Center data from 2021 shows that young men aged 18, 34 are now twice as likely to live with their parents than with a spouse or partner. Traditional masculinity norms discourage emotional vulnerability, making it harder for men to seek support and form meaningful friendships. Psychological consequences of loneliness among men include depression, anxiety, and an increased risk of suicide. Men are less likely than women to seek therapy, leading to untreated mental health issues. The suicide rate for men is 3.9 times higher than for women, with white, middle-aged men making up 70% of suicides in the U.S. CDC 2022. Chronic loneliness contributes to heightened stress responses, leading to hypertension, sleep disturbances, and cognitive decline. Men who feel socially isolated are more likely to withdraw further, exacerbating mental health challenges and increasing the likelihood of engaging in high-risk behaviors such as substance abuse. Neurologically, loneliness triggers changes in brain function that make social reintegration more difficult. The amygdala, responsible for processing emotions and fear, becomes more active in lonely individuals, making them hypersensitive to social rejection. At the same time, the prefrontal cortex, which regulates emotions and decision-making, becomes less effective, making it harder for lonely men to manage their emotions. Social interaction is essential for dopamine production, and without it, men experience dopamine depletion, reducing motivation and increasing susceptibility to addiction. Biologically, loneliness has severe health effects. Chronic loneliness elevates cortisol levels, increasing the risk of cardiovascular diseases. Isolated individuals have weaker immune systems, with lower white blood cell counts, making them more vulnerable to infections. Loneliness also raises inflammation markers such as C-reactive protein, CRP, which is linked to heart disease, diabetes, and even Alzheimer's disease. Work-related loneliness is another factor that negatively impacts men. Unemployment is associated with a 2.5 times higher risk of depression among men, National Bureau of Economic Research 2022. The rise of remote work has further reduced daily social interactions, leading to increased isolation. High-stress jobs such as construction, military service, and law enforcement have above-average suicide rates due to job stress, lack of mental health support, and cultural stigmas around seeking help. Substance abuse is another major consequence of male loneliness. Men are twice as likely as women to suffer from alcohol use disorder, National Institute on Alcohol Abuse and Alcoholism 2021. Additionally, 80% of opioid overdose deaths involve men, with many turning to opioids initially for pain relief but continuing due to social and emotional distress, CDC 2022. Lonely men are also more likely to engage in reckless behaviors such as binge drinking, gambling, and unsafe sex. Homelessness is both a cause and a consequence of loneliness. Men make up 70% of the homeless population in the U.S., HUD Annual Homeless Assessment Report 2023. Among homeless veterans, over 90% are men, many of whom suffer from PTSD, lack of social support, and financial instability. Nearly 50% of homeless men struggle with severe mental illnesses, including schizophrenia, bipolar disorder, and major depression. War veterans are particularly vulnerable to loneliness, PTSD, and suicide. 1 in 5 Iraq and Afghanistan veterans experience PTSD, which often leads to social withdrawal. Veterans account for 13% of all suicides in the U.S., despite making up only 7% of the population. Many veterans struggle with reintegration into civilian life, leading to social isolation and mental health challenges. Addressing male loneliness requires systemic changes. Encouraging male friendships through social groups, mentorship programs, and reducing stigma around vulnerability can help. Workplace mental health initiatives should focus on high-risk industries, and companies should create opportunities for socialization, especially for remote workers. Expanding mental health resources, improving accessibility to therapy, and normalizing emotional expression among men are crucial steps. Combating substance abuse and homelessness requires investing in addiction treatment and harm reduction programs, as well as expanding social services for at-risk men. Veterans need stronger post-service support networks, mental health care, and employment opportunities to help them reintegrate into society. Male loneliness in the U.S. is a complex crisis that affects mental, social, physical, and economic well-being. With rising suicide rates, increasing substance abuse, and declining social connections, urgent action is needed. Understanding loneliness through sociological, psychological, neurological, and biological lenses provides a comprehensive view of the issue and highlights possible solutions.